More than 3 million North Carolinians utilize Medicaid, and while the program will remain operable tomorrow, there is uncertainty over the potential impact of those reductions.
These are the people in our community that need help the most.
Jenny Hobbs's two youngest children have health conditions that require ongoing medical care and are supported by Medicaid. She says without access to the program, her family would not be able to afford the same level of services.
But I do worry about over time if providers are going to decide they just can't deal with Medicaid anymore.
NCDHHS says the 5% reimbursement reduction essentially means providers will receive less money for the same level of work, which could impact the number of Medicaid patients they choose to see.
And we already have trouble finding doctors who will accept Medicaid and have the expertise to support people with intellectual and developmental disabilities.
At the center of those budget negotiations among Republican leadership in both chambers are disagreements over funding for a new children's hospital in Raleigh and rural health investments.
We can't treat health care access as a political football.
Republicans have disputed whether the reimbursement rate cuts are necessary. Lauren Horse, a spokesperson for Senate President Phil Berger, writing in part, quote, Governor Stein and his health department can reverse the proposed cuts now but refuse to do so. There is no need to make these hasty, politically motivated cuts now. Since this summer, the Senate has been in favor of funding the Medicaid rebates at the amount recommended by the General Assembly's nonpartisan fiscal staff. Meanwhile, a spokesperson for the governor's office wrote, quote, Governor Stein continues to urge the General Assembly to put North Carolinians' health over their political disputes. Governor Stein and DHHS have identified cuts that can be reversed if the legislature comes back in October and funds Medicaid.
I'm Michael Perchik, ABC 11 Eyewitness News.